The Stellar Phase 3 trial. A study of sotatercept in combination with background therapy for the treatment of pulmonary arterial hypertension. Pulmonary arterial hypertension is a progressive disease caused by pulmonary vascular remodeling. In part, this is due to an imbalance between proliferative and anti-proliferative signaling pathways. Among proliferative signaling pathways, activin plays a significant role. This leads to pulmonary endothelial and smooth muscle cell proliferation with sustained vasoconstriction and inflammation, resulting in rigid luminal narrowing of pulmonary arteries. Sotatercept is a first-in-class activin signaling pathway. It is a fusion protein. It's a fusion of human immunoglobulin, which is bound to the activin type 2A receptor. So it binds and removes activin, which is involved in progressive remodeling, thus rebalancing the vascular homeostasis. Furthermore, it may result in reverse remodeling. In animal models, there is some regression of the disease because the endothelial cells and smooth muscle cells, which obliterate the lumen, could go into apoptosis. Stellar is a randomized control trial which enrolled patients with pulmonary arterial hypertension and functional class 2 or 3 patients. They had a 6-minute walk distance of 150 to 500 meters. They were on background therapy with approved pulmonary arterial hypertension medications. Patients received placebo or sotatercept every 3 weeks. The primary outcome was change in 6-minute walk distance at 24 weeks. Average age of the subjects was around 48 years. 80% were female. The cause of PH was mostly idiopathic, heritable, or connective tissue disease. Average time of enrollment since diagnosis was 9 years. They were mostly functional class 2 to 3 with a 6-minute walk distance of about 400 meters. Mean pulmonary artery pressure was about 53 millimeters of mercury. About 40% of patients were on IV prostacyclin, and majority of patients were on either double or triple therapy. 323 patients were randomized. The study met its primary endpoint. This shows you the observed mean change of 6-minute walk distance from baseline to week 24. In the placebo group, there was a change of -1 meter. In the treatment group, there was an improvement of 40 meters. This was highly statistically significant with a p-value of less than 0.001. In addition to that, the study met 8 out of the 9 pre-specified secondary endpoints. This included a multi-component improvement, which is a composite of functional class, 6-minute walk, and NT-proBNP. The PVR fell by about 235 dyne, which is like 3 wood units. There was a significant improvement in NT-proBNP coming down by about 442. There was a significant improvement in functional class. There was a significant improvement in time to clinical worsening or all-cause death, of which I'll show you more details. 2 of the 3 domains of the PAH Quality of Life SYMPACT tool was statistically positive as well. There was also a 14 millimeter decline in pulmonary artery pressures. These are the curves for the time to first occurrence of death or non-fatal clinical worsening event. You can see that 42 patients in the placebo group experienced a clinical worsening, but only 9 patients, which is only 5.5%, in the treatment group experienced a clinical worsening. This is a hazard ratio of 0.16, so an 84% risk reduction. The treatment-related adverse events were more common with sotatercept overall. However, the serious or severe adverse events leading to study discontinuation were actually more in the placebo group. The adverse events in the treatment group represented a lot of minor nosebleeds and gum bleeds. There was some development of telangiectasia, as well as mild thrombocytopenia and a slight increase in blood pressure. In conclusion, Stellar is the first Phase 3 trial of sotatercept, an activin signaling inhibitor, in adults with pulmonary arterial hypertension and functional class 2 to 3. There was a significant and relevant improvement in 6-minute walk distance. This was associated with broad clinical benefits across multiple domains, including hemodynamics, functional class, biomarkers, and patient-reported outcomes. It also reduced the risk of death and non-fatal clinical worsening outcomes by 84% compared to placebo. It was generally well tolerated, but there were some side effects, including bleeding complications and telangiectasia. According to the authors, these results establish the clinical utility of sotatercept in combination with approved PAH therapies.